Ananthapuri Hospital and Research Institute has a very unique story of its own. It had a very humble beginning more than 15 years ago as a small 25-bedded hospital. A group of very renowned doctors came together to build this dream. They were literally stalwarts in their own field. Doctors such as our current chairman, Padma Shri Dr. A. Ananthapuri, who is one of the pioneers of neurosurgery, Dr. C.G. Bahulayan, who is considered one of the pioneers of interventional cardiology, Dr. Kashi Vishweshwaran, our current head of nephrology, Dr. Mahadevan, head of anesthesia, Dr. Gopal, orthopedics, Dr. Madhavan Nair from ENT, and Dr. Sharada Devi from gynecology. These people came together to build this dream 15 years ago. And today, 15 years later, Ananthapuri Hospital and Research Institute is a quaternary care referral hospital for the entire state of Kerala as well as South India. Ananthapuri Hospital was initially conceived as a center of excellence in neurosurgery and cardiology. Patients with very complex neurosurgical problems, spinal cord problems, and head injuries still get referred to us. In cardiology, patients with severe coronary artery disease who require very advanced imaging tools and technology to open up these vessels are still being referred to us because of the state-of-the-art cath lab that we have. And 15 years later, we are actually a center of excellence in almost all specialties: nephrology, urology, including kidney transplantation. We take care of high-risk pregnancies, and we have a very highly equipped pediatrics and neonatal wing, orthopedic department with joint replacement center, as well as oncology and cancer care. Our critical care team requires a special mention. With 12 ICUs and more than 100 sick patients in the ICUs, we have a very strong critical care department available 24/7 taking care of very sick patients. There are a lot of very sick patients who get referred to us, such as septic shock and polytrauma and so forth.
Ananthapuri Hospital and Research Institute near the International Airport in Trivandrum has in a very short period of time established itself as one of the leading tertiary care hospital, not only in Kerala but among the southern states of India. It's a multi-speciality hospital with almost all the specialities, and each department we have at least 6 or 7 consultants, very senior doctors with a lot of experience and good background, along with dynamic youngsters who are committed to healthcare is our asset. We have all investigative facilities, right from MRI scan, CT scan, EEG, and we are doing transplant surgery, and the trauma care is one of the major departments in our hospital, catering to at least 6 or 7 of the southern districts in Kerala and Tamil Nadu, and even from local hospitals in the city itself. Ours is the last resort for critical care and trauma care. It's a very well established department with at least 4 or 5 intensive care units, and is doing yeoman service for the trauma victims. Our cardiology department is one of the best, with Dr. C.G. Bahulayan as the head of the department, and we have all the facilities here. And electrophysiology is a new section that we have added on. Like that, every department is very strong. Nephrology, we have 24-hour dialysis, at least 15 or 18 dialysis machines, and also renal transplant is being regularly done. And anesthesia department is very good. Critical care is a very strong department looking after almost 150 critical beds in our hospital. And gynecology, pediatrics, neonatology, ENT, all departments are working very well. We are getting quite a lot of clientele, not only from Kerala and Tamil Nadu and other states, but also from foreign countries, including Arab countries, Oman, Saudi Arabia, and Sri Lanka and Mali. So we are adding on to our facilities, and apart from the top class healthcare that we are providing, we are equally interested in research, and we have a public health section also, Global Institute of Public Health, where we are conducting Master in Public Health courses and doing a lot of research in the public health domain. All other departments are also involved in quality research in the clinical setup. And yet another plus point is that we are having postgraduate medical education program through the National Board of Examinations. So the DIPNP course, almost all departments we are running, and these youngsters are really the backbone of healthcare that we are providing. We also have the nursing college, both MSc and BSc nursing, and at least 14 paramedical courses are being conducted in our paramedical institute. So much so, a high level of clinical work, academic activities, research, public health initiatives, and teaching, and also postgraduate courses. So that is our strength, and we are confident to look after your health once you prefer to be with us.
Cardiology service in the Cardiovascular Center of Ananthapuri Hospital Research Institute, Trivandrum, offers state-of-art care for all cardiology patients. The department has got full-swing non-invasive setup, which includes treadmill testing, echocardiography, and all varieties of non-invasive investigations. It has got a state-of-the-art cardiac cath lab, which offers round-the-clock service of coronary interventions and other types of cardiac interventions. And it has got a full-swing electrophysiological department offering treatment for various types of arrhythmias. Now, as way of treatment, we were keeping in the par with all the other centers in major hospitals, but however, in terms of coronary intervention, we have made a headway during the last several years. The Cardiovascular Center at Ananthapuri Hospital stands out in the fact that it has acquired all the necessary equipments for performing best of practice angioplasty for these patients. That includes what is known as optimization of angioplasty.
We have a fully automated biochemistry equipment, Vitros 5600 and Vitros FAQT 90. And hematology, we have Beckman and Coulter Horiba machine. And for microbiology, we have Vitec, Bactelert, and Vitros ECI. Our blood bank is the most advanced with imported component separator. Our radiology and imaging services is worth mentioning. We have a 28 slice CT scan, 1.5 Tesla MRI scan, and we have 4 state-of-art ultrasound machines, mammogram, and to support the neurology department, we have a video EEG lab, EMG, and nerve conduction study labs. And we have a very state-of-art sleep lab as well. Trauma center of our hospital. Our hospital is the top polytrauma care center with a multidisciplinary team approach. We are handling all high velocity complicated trauma, including pelvic fractures. We have a very good joint replacement and arthroscopic team as well.
Any type of renal disease, acute or chronic, or various types of investigative procedures are done, including renal biopsy. Renal biopsy is done under ultrasound guidance, and the necessary laboratory investigations are all available. We also have higher training in nephrology with candidates selected by the National Board of Examinations for training in nephrology, as well as we have the diploma course for dialysis technicians. In addition to the regular dialysis, maintenance hemodialysis consisting of regular twice weekly or thrice weekly hemodialysis, we also offer various types of treatments for acute kidney injury like sustained low efficiency dialysis or the CRRT modified versions. Renal biopsy is done under ultrasound guidance, and it's a relatively safe procedure where the patient has to stay in the hospital for just about 24 hours. Other procedures like plasma exchange, hemoperfusion are also available and are done as indicated. We have a very efficient and very active pediatric nephrology department where small children, even newborns, are taken care of by the pediatric nephrology team. Renal transplantation is also possible, and it is done for related donors in this department. The minimum waiting time.
The plus point with the hospital is all of us had been heading the respective departments in various government institutions, teaching institutions, medical colleges, government hospitals, etc. for more than 3 to 4 decades. And that experience, along with the goodwill which people has bestowed on us, has come into a great asset for us when we started the institute, and that is one of the reasons for our success. Being in charge of the surgical services of this institute, I am very proud to say that all of our surgical departments are doing extremely well. The experience clubbed with youth. We have a lot of young dynamic surgeons and physicians or clinicians coming to join us. Their youth, their enthusiasm with our experience paves a long way for the hospital, for the institute to come up. We do a lot of research activities, and with the state-of-art knowledge, the state-of-art technologies, the state-of-art equipments, I am very proud to say that we are ranked among one of the best, definitely in the state. Some of our specialties are really internationally acclaimed. We get a lot of international patients, and we make sure that we put our maximum effort to see that all the patients go back happily.
Operation Theatre Ananthapuri Hospital and the Department of Anesthesiology is one of the best in the country, with state-of-art facilities and expert faculty members, excellent teachers, and well-trained in anesthesia and intensive care. And we have got 12 operation theatres working simultaneously with state-of-art facilities.
This is one of the operation theatres in this theatre complex. Here we do neurosurgery. We are here well equipped with all the equipments with the international standards to do any kind of complicated neurosurgeries. We have HEPA filter, laminar flow, most modern anesthesia machines, most modern anesthesia monitors, bronchoscopes, ultrasound machine, most modern operating table, theatre lights, and anything you name it, we have it here, like any other developed country in the world.
We have got a dedicated critical care unit which has 12 ICUs covering 120 beds, and basically it has neuromedical ICU, neurosurgical ICU, neurotrauma ICU, general surgery ICU, critical care ICU, and then pediatric ICU, cardiology ICU. It goes on up to 12 intensive care units. And basically what we are doing is it caters all the intensive care units of a hospital, not only the critical care department. We caters all the patients who are admitted under each specialty ICUs. That means the quality of each ICU goes up. And last year we got the NIH accreditation for our intensive care units, and we have got the lowest infection rate in the state for as far as ICU is concerned. You can see this patient came with severe head injury and fractured ribs, and right now that patient is on minimally invasive ventilation and with an epidural for complete analgesia. That means patient is fully conscious, taking normal diet, and he is without any pain with plenty of fractures around. So that is the latest mode of treatment we provide for severe chest injuries. That is a major aspect of our ICU management.
Our department of obstetrics and gynecology in Ananthapuri Hospital and Research Institute is run by a panel of 13 well-experienced, well-qualified gynecologists, including 4 professors. Excellent facilities and services available for complicated pregnancies and deliveries as eclampsia, severe preeclampsia, diabetes complicating pregnancies, and other diseases like heart disease, nephritis, and other diseases complicating pregnancy by experts. Routinely do laparoscopic surgeries, all laparoscopic surgeries including lap hysterectomy and laparoscopic surgery for endometriosis, ovarian cyst, etc. All the gynecological emergencies are dealt with by experienced gynecologists.
The Department of Pediatrics and Neonatology at Ananthapuri Hospitals and Research Institute has got an excellent state-of-the-art neonatal and pediatric ICU complex which consists of around 17 pediatric beds and 10 neonatal beds, including isolation beds, manned by an excellent team of senior consultants with international clinical experience, with neonatologists available round the clock. We also provide facilities for safe transport of emergency neonatal and pediatric cases by an excellent transport team. We provide advanced neonatal care for high-risk newborns, including extreme preterm babies, with provision for all invasive and non-invasive procedures, and which is supervised round the clock by neonatology team. We have got an excellent pediatric subspecialty coverage which provides a comprehensive coverage of all cases with senior consultant with international clinical experience, including pediatric surgeons, pediatric nephrologist, pediatric endocrinologist, neurologist, rheumatologist, cardiologist, and a pediatric nutrition team. The department has also got a comprehensive developmental pediatric team consisting of developmental therapist, physiotherapist, occupational therapist, speech therapist, psychologist, and ophthalmologist for providing neurodevelopmental follow-up for all our high-risk newborns and also children with developmental issues.
Located right next to the international airport in the picturesque city of Trivandrum, at a healthcare cost almost 1/5 of what has to be spent abroad, and a quality of care at par or better than what can be delivered in the Western nation, Ananthapuri Hospital in Trivandrum is definitely a very popular health tourism destination. We already take care of a lot of patients from abroad, including the Gulf countries and Maldives, and we look forward to taking care of more patients from abroad.